Good morning everyone and welcome to this presentation. Today I am going to talk about clinical assessment of peripheral arterial disease of the lower limbs. I am going to talk about definition, applications in medicine, pros and cons, applies in Ecuador, and finally a conclusion. I am Daniel David Hipe Zambrano and this presentation is for the medical English class. Let's start with the definition. Arterial perfusion of the lower limbs is commonly encountered in general and specialist practice and has both acute and chronic presentation. A systematic assessment of patients with this condition is essential to prevent lymph or tissue loss. Applications in medicine. A Doppler proof and a blood pressure cuff should be available to the examination. Introduce yourself to the patient and obtain consent to perform the examination. Ask how the patient is feeling and whether there is any pain or tenderness. The patient should have been instructed to remove clothing such that the lower limbs are completely exposed. Pros and cons. Well, the pros. Physical therapy can help someone avoid surgery and pain, learn to walk after an injury, get stronger, gain motion, be able to perform desired tasks or activities, and much more. And cons, physical therapy costs money, health insurance usually covers some or all of the cost and takes time. And pros versus cons, overall the pros of attending physical therapy far outweigh the cons. Applies in Ecuador. In Ecuador, these types of pathologies are diagnosed by a vascular specialist and together with the physical therapist are solved. And finally, the conclusion. When you perform a vascular arterial assessment of the legs, bear in mind the underlying arterial anatomy and its effects of perfusion of the skin, soft tissues, and bones. If the patient has signs of a peripheral arterial disease, obtain a rapid consultation with a vascular specialist. If there are signs or symptoms of acute ischemia, send the patients to the emergency department immediately for additional assessment and imaging of the arterial anatomy. Thank you so much for your attention.